And there are growing concerns about how pregnant women are shying away from the hospitals over fears of contracting the virus and infecting their unborn babies. In a bid to protect expectant mothers and their babies, the Greater Accra Regional Hospital has rolled out a comprehensive protocol, including the creation of 3 isolation rooms for expectant mothers. The new protocol, which includes the prioritization of COVID-19 tests for expectant mothers who are visiting the facility for the first time, is to reassure them about the hospital environment, that it is safe for them. Latif Idris has more in this report.
The WHO has prescribed a 1-meter distance as part of the precautionary measures to prevent the spread of the coronavirus. But what if you cannot keep that distance, or you are unable to keep any distance at all? That is the grim reality for babies lying in the womb of mothers who have tested positive for the virus.
Acting head of the Department of Obstetrics and Gynecology at the Accra Hospital, who took me on a tour at the facility, Dr. Kwabena Omari Eboa says the new protocol, including the creation of isolation rooms, are inspired by the facility's commitment to protect pregnant women.
That is the call we are making to the public, that particularly the pregnant women, don't stay home with the fear that when we go there, we will have COVID. Because we've put in place measures to deal with them, to protect them, particularly our pregnant women, because you can't postpone pregnancy, you can't postpone delivery. And so we don't want the situation where, because of COVID, we have mortalities due to other conditions. And so we expect that people, when they are sick, when they have a challenge, particularly pregnant women, will come in. And when they come, we expect that the measures that we have put in place, they support us to implement it so that it will protect them, will protect us, and will protect their relations as well.
And what Dr. Omari didn't add is that you can't postpone labor as well as an expectant mother.
Of course.
With increasing level of apprehension among expectant mothers, Administrator at the Greater Accra Regional Hospital, Dr. Emmanuel Srefenyo, says the facility has a protocol that is trigger-ready to accommodate expectant mothers who may test positive for the virus.
The system is quite ready in the sense that we have a room. First of all, we have a system that we call the pre-triage. So we will not allow you to mingle with the people before the initial screening questions are asked. So at that point, if there is a reason to suspect that you may have the condition, we will not allow you to mingle with the other people. From there, we will send you to what we call the holding center, or a room that has been designated within the maternity department, which we call the holding center, and you'll be all by yourself in that room, but staff in appropriate gear, appropriate PPE can come to you and manage you.
Director of Institutional Care at the Ghana Health Service, Dr. Samuel Kaba-Korea, says the protocol by RAGE is to instill trust in the health facilities.
We've prioritized testing for them, and that is if once we label it that pregnant or labor, you get your results very quick for 2 reasons. One is to make sure that they get the service as fast as possible, and second, to make sure that they are well protected. And they take all the necessary measures to protect the pregnant woman and then the newborn. Because one of the things we don't want is people to lose trust in our health facilities.
Obstetrician, gynecologist, and member of the Family Health Division of the Ghana Health Service, Dr. Chris Opoku-Fofie, tells me the unit is preparing for the worst-case scenario.
Some of our preventive measures, we hope, are working well. We might not get into that grim picture that others might be forecasting. Notwithstanding, we are preparing for the worst, and that means we are streamlining, or we are maximizing our potential. When I say that, what I mean is that within our health facilities, we are putting in structures so that women who come to deliver will still be safe at any given time.
As far as authorities at the Greater Accra Hospital are concerned, their facility and many other health facilities remain the safest place for expectant mothers to visit.